Is blood donation safe? This is a question that many people ask because unfortunately, as with lots of things in life, there's myths and there's facts. By and large, generally, blood donation is a really safe process. When one donates blood, we have staff who are fully trained, responsible for collecting the blood. They explain the process if you are a first-time blood donor, and in addition to that, all the equipment that we use for blood collection when one donates is completely sterile, and parts of that equipment that can be thrown away actually is used once. For instance, the needles are only used once, obviously. One needs to, however, be aware that there is potential side effects or adverse effects that can happen when one donates blood. And the most common is that one can get bruising on the site where they donated blood. So you can get bruising, or what we call a hematoma, at the site where the needle was inserted. Sometimes this can lead to pain in the arm. Sometimes when the needle is being inserted, one can also puncture the nerve because the nerve lies quite close to the vein in the arm. And that can then lead to some nerve or tendon injury or pain related to that. But one needs to be cognizant of the fact that generally the adverse events to donation are very minimal. We have less than 2% of our donors actually get adverse events. In fact, for the last year, we had about 0.6% of our donors had experienced adverse events from blood donation. Another very common side effect to donating, unfortunately, is lightheadedness. That lightheadedness in some individuals can be significant to the point of fainting. So there's always the risk of fainting. And that is one of the most significant risks, because if one donates blood and then gets up and goes without really resting, there is always that potential risk of a faint. And what we do encourage our donors is to try and take a bit of time to actually sit and allow your body to kind of recover, so to speak, because you've just given away fluid. Take in some fluids and take another 20 minutes or so to sit and rest a little bit after donation. That kind of helps your body to also recover and reduces that your risk of faints, although it doesn't entirely take away that risk. And another measure that we have in place is that our staff is fully trained to recognize the side effects, and if one needs additional treatment, we refer them for that.